Would appreciate that. Keep them coming in. Thank you very much for joining.
Thank you, everyone. Please let's keep putting in the chat as we're joining, where we are joining from. Thank you so much. I can see in the chat people from Abuja, from Shagamu, from Owerri, from Ado-Ekiti. So let's keep putting in the charts where we are joining from. We'll get started in the next 1-2 minutes. And like we know, just to give a bit of a context to why we are having this today, the month is a month of prostate cancer awareness, like we're all aware of or may not be aware of. And what MDoc Healthcare has done at this period is to have a series of events to commemorate the Prostate Cancer Awareness Month, which is in the month of September. Line up with a couple of activities started from our community engagement, and culminating in today where we will be having some real conversations, in the word we used to say man to man, right, regarding prostate cancer and the prevalence, and the things that we all need to know about prostate cancer, both as men and as people who have men in our lives. So please keep putting in the chat where you're joining from. Let's engage, and we'll get started in the next couple of minutes. Okay, so I think we can get started now. And I'm going to ask a simple question to everyone, right? I know today is a Sunday, right? So just a simple question, you can respond to it in the chat. So if you, as a human being, let's say, you all watch sci-fi movies, and then a meteorite landed on Earth today and landed in Lagos and in Owerri and in Ibadan and in Ado-Ekiti and in Abuja. And this meteorite was granting superpowers to everybody, right? And you were in that vicinity where that was happening. If you could pick a superpower, which superpower would you pick from the ones that are available? So the meteorite landed in Nigeria, across the different states, and it's giving everyone superpower, but you can only pick one. So if you can pick one, I'm ready to respond. Somebody is saying 1 billion naira every day. Wonderful. All right, so please put in the chat what superpower would you pick, and which ones would you want to have? Just one. You can only pick one. You can't pick more than one. What would that superpower be for you as an individual? So I see Solomon puts in the chat he would want to make 1 billion naira every day. I think my own would be to be okay. So I'll repeat the question, Nampak. So we emitted a meteorite, right? It came from outer space into Nigeria, and it's granting people superpowers. And but you can only pick one superpower, right? So what would that superpower be if you could only pick one? What was like your superpower that you would want to have? What would that be? So I see Emmanuel puts he would want to have a healing superpower. That's very noble. That's very noble. Me, I would want to have the superpower to be able to travel through time. That's my own, right? I mean, my own is to be able to travel through time. And if you could also explain why, right, in the chat, that would be wonderful. Okay, I see someone is saying, sorry, I'm trying to see the chat. Okay, superpower for wisdom and knowledge. Interesting. Okay, that's from Chris Benson. Okay, so Mampak, I see your response now. To care super extraordinarily. People are really noble. That is wonderful. And that is great, right? That is great to see. Um, you know, to care super extraordinarily. That is a wonderful one. That is a wonderful one. Please let's keep it coming in the charts. What would you want your superpower to be as an individual? Health. So I see that's from Isim Ehen. I hope I didn't murder the name. Then it says health would be his own superpower, and I think yes, it would be great to have the power to say everybody should be healthy, be healthy, right? Healing superpower. I see a lot of healing superpower coming up, which is great, which is wonderful. Daniel is saying to understand any skill or solve any problem he wants. That is wonderful. Olumide is saying the superpower to solve problems at the speed of light. Interesting. Interesting. Thank you so much, everyone, so far for your contribution. And I think, we can get started now with a round of introductions. I don't write since people are healing and have money. Please let me travel around the world without stress. So she wants teleporting. That's our own superpower. That's again, I mean, similar. Mine is to be able to go through time, back and forth. Yeah, Aisha is saying teleportation. Interesting. Thank you so much, everyone, for your contribution so far. So I'll hand over to my co-host, Titilayo, so that we can get started. Over to you, Titilayo.
Thank you very much, Dr. Kola. Thank you once again, everyone, for the engagement so far. It has been so interesting. So, all right. So we just run us through some of the rules of this session as we go along, so that we can all familiarize ourselves with the session proper. So kindly note that this session is being recorded on while we're here, and the reason for this recording is because would like to share would like to share the recording with participants at the end of the meeting, so that you can have this recording and then you can reflect on it, and then you can also go over the presentation by our speaker, and then you can reflect more and even get more knowledge from the session. Thank you very much. So we'll be moving into some key participation tips. please, we encourage you, just like you've started already, we encourage you that you try and engage with us while on this session, engage with us, engage with other participants on the call. We want this to be so much interactive. We don't want it to be just us um speaking to you. We also want to hear back, and I'm glad to see that there has been some form of conversation in the chat since we started. So please keep the engagement going. Um, that's very, very thoughtful of you all. And so please, we would also like you to have your camera on. I mean, we would like to see your faces, your handsome faces, your beautiful faces. Would like to see them. So please, and also it makes it more lively to see that we are speaking to we are seeing the faces of these people we are engaging with. Also, the facilitator will unmute you when you want to speak, but please don't forget to use the raise hand function in the Zoom on your Zoom platform when you need to speak. Once we see your hand raised, the facilitator would um, unmute you so you are able to speak. Also, use the chat function to ask any questions. I'm sure there are going to be a lot of questions on our minds today. So please, the chat is available for us to use. So ensure to use the chat to ask your questions, drop your comments. Let's know how you're feeling us this afternoon, how you're enjoying the program as we're going. And then please note that we are here to provide you with all the technical support you may need all through the event. So if you require any technical support, feel free to put in the chat, and then our technical team will be there to support you and provide the support you need. So I'll just quickly run us through our agenda for today. We've already started the welcome and introductions. Um, and then please keep the introductions coming. I know more and more people are joining, so please, as you're joining the call, drop in your name and the location you're joining us from. And then we'll be having our pre-quiz. We just want to test your knowledge on what you know about prostate cancer. I mean, that is the reason we are here today, to educate ourselves and to learn. That is the reason we are here today. So the pre-quiz is a very short quiz. You don't have to think it through. Just answer to the best of your knowledge. Don't overthink. We are not going to we are not going to penalize anyone for any wrong answer. So please just keep it just don't think it through, just answer it to the best of your knowledge. And then we have one of our member come up to tell us briefly about what we do at MDoc and our oncology. We have an oncology program where we support people living with cancer. So we have someone that will be coming up to talk to you about that. And then we also have a testimonial from one of our members. We call them members, we don't call them patients. So we have a testimonial from one of our members that would also be sharing to let you know how we've supported him so far on his journey with dealing with cancer. And then we go into another game. We're going to be playing the game. Like I said, while we are learning, we also want to have some fun. So we're playing another game. And just after the game, our key speaker will be coming on to take us on the subject matter. So please, when we get to that point, I want everyone to have their pen and paper, even though we'll be sending the presentation to you, but then, you don't want to miss out on the things that he would be saying to us today. And briefly after his presentation, we'll be having the Q&A, and then we take the post quiz before we say our goodbyes and end the session. Okay, so now we are at the point where we need to take a pre-quiz. Like I said earlier, you don't have to think it through, don't overthink it, just answer it to the best of your knowledge. And then after our key speaker presentation, we'll take the post-quiz so that we know that you have actually learned from all that has been said today. So if we'll have the pre-quiz go up now so that some people can start responding to it. Thank you very much.
Yes, thank you, Titi. So just to also put context, we have just a very few minutes for the pre-quiz, so we would appreciate everyone can start answering. If you're having difficulty, please let us know in the chat very quickly, and we'll resolve that for you. We just have a very few minutes to answer the pre-quiz so we can get into the rest of the activities. So I want to believe the pre-quiz is up right now, team. Wonderful. So please go ahead and answer the pre-quiz. We see a lot of people in the room. Please answer the pre-quiz. We're giving, like I said, just a very, short time. Quickly take the pre-quiz. Don't overthink it. Just answer, to the best of your ability. That's why we are here to learn today from our keynote speaker, and we'll also be having other conversations. So very quickly, let's start answering. If you can't see the quiz, please let us know in the chat. Someone will attend to you to get across to you and get you sorted out. But if you can't see the quiz, just take again. We made it so very easy. This is not an assessment test of any sort, right? It's just for us to know where we are, and then in post the session also see how much we have learned. So please don't overthink it. Just answer as best as you can. And then after the engagement, we will know that we've learned a lot from this. So I see the responses are coming in. Thank you so much. Let's keep them coming in very quickly because, we have little time for this. Let's keep them coming in. Let's keep them coming in. Thank you so much. I see people are already doing the quiz. Thank you. Thank you. Let's keep them coming. Let's keep them coming very quickly. Thank you so much. We have a few minutes left for this. Thank you. I see much more people are answering. Thank you. Let's keep it coming. We still have a sizable number that are yet to complete the quiz. Let's all do that. Thank you so much. Again, if you're unable to see the quiz, just put in the chat. Someone will attend to you and share and sort you out. But if you can, let's keep the responses coming. I see more people are answering. Thank you. We have just 1 minute and 30 seconds left to answer the quiz. Thank you. Thank you. Let's keep the responses coming in. Let's keep it coming in. I see we are way past the half point of people on the call. We still have more people still yet to complete the quiz. Let's keep them coming in. Thank you so much, everyone answering. Okay, we have just about a minute left for the quiz. Thank you for the responses. Again, if you have any challenge at all, just let us know in the chat. We will, respond and address to this. Like I said, the whole essence of this today's session is for us to educate ourselves, remind ourselves regarding the burden that is prostate cancer, particularly as it affects men. Within Nigeria and beyond, in the context of our setting, and to understand what are the risk factors, how do we prepare for that, and how do we also, as a collaborative, what steps can we take in the prevention, of this disease burden. Thank you so much, everyone. I see more people are responding. We have 30 seconds left for the quiz. Please, if you haven't answered the quiz or you're just joining us, there is a current pre-quiz up on your screen that has questions that you have to answer. Please go ahead and do that. We have about 30 seconds left to do this. Yes. So for once you submit your responses, I see your question, Mampak. By the end of the session, right, there would be we would share the post quiz so that you can see as well and know how to answer better with the results. So at the end of the session, when we take the post quiz, we will show the results for that. Okay, we have 20 seconds left, and I'll be counting down to close the polls. Please I beg your pardon. Please let's answer. I see there are still a few people left who have not yet done the quiz. Please do that. We're giving you 15 more seconds to do this so that we can close the pre-quiz and get to the program fully. Thank you so much to everyone who has done this. If you're just joining, there is a pre-quiz up for you to respond to. Kindly help us do that so that we can move to the next part of the program. There are still a couple of people who haven't responded. Please do that. We are closing the poll in the next 15 seconds. Thank you. I see some more coming in. Please, let's fill it out. There are still a couple of people who are yet to fill out the pre-quiz. Kindly help do that. Thank you. All right, thank you. So we are closing the polls, the pre-quiz now. So I'm going to count to 10. Just give 10 seconds if you haven't yet responded. We're going to close the quiz in 10, 9. Oh, I see someone just responded again. 8. Please, you can quickly fill it out. 7, 6, 5. Okay, I see another person that's quickly responded. Thank you. 4, 3, 2, 1, and 0. Thank you so much. We'll be closing the pre-quiz now. Thank you so much, everyone. Like I said earlier, we will be sharing the results during the post-quiz session, and then we'll take it up from there. So thank you. Over to the co-facilitator to take it up from there. Thank you.
Thank you very much, Dr. Kola. Okay, so yes, so just briefly introduce who we are at MDoc. So we'll be doing this very quickly. So MDoc, we optimize the end-to-end self-care experience for people living with regular and chronic health need by harnessing quality improvement methodologies, behavioral science, data, and technology/AI. And so we do this by offering a 4-pillar high-tech, high-touch approach to integrate self-care, a key component of primary care. And in the midst of all we do, we ensure that we put our members, because like I said earlier, we call them members, we don't call them patients. So our members get access to virtual coaches and digital nudges through our omnichannel complete health platform. Also, they get a digital patient navigation via our Navi Health AI platform. So our Navi Health AI platform is a platform where you can search for health directories that are closest to you in case you need to access one, and then you can get the access and locate them. And the good thing about our Navi Health is after receiving the service from the provider, you can drop your feedback on the service you got from that provider. Also, we have a capacity building, which includes tele-education for providers and patients, just like the one we are having right now. And this is called our MDoc Quality Network. And then finally, we have our in-person community-based nudge hubs where our members can walk in to have to speak with our coaches, speak with our hub ambassadors and community ambassadors, and then they can put a face across to the people that they speak to on the phone. So this is just a short video to tell you to put you through how to download our complete health platform and also how to get started using the app. So just listen and quickly we get into this.
Video is a brief walkthrough through our complete health mobile application. When you download the app, it takes you to this page, and then you can choose to either sign up or log in. To sign up, please include your first name, your last name, your email address, your phone number, and a unique password. Please ensure that the password is strong, it is unique, and it is imputed twice. After that, you can now create an account. When you click on create an account, a verification code is sent to your phone. Kindly input the verification code and your account will be active. Now you can proceed to fill in your profile. In your profile, you need to fill in your gender, your date of birth, your height, and your weight. Your height and your weight are necessary because this is required to calculate your BMI, which is your body mass index. And after that, you fill in your level of education and your income level. So after signing up, the next thing to do is to subscribe for a program. To do this, please go to the homepage and click on your name. After that, click on profile information and then click on subscriptions to the right. This will take you through a list of the available programs at MNOC. So for the purpose of this video, let's select Propel and we'll select free version and click on checkout. Checkout confirms payment and immediately takes you to fill out a BLA, which is your baseline assessment. After filling the BLA, you'll be automatically assigned to a health coach. Now, to confirm your subscriptions, please go to your homepage and click on My Subscriptions. This will show you the list of all the programs you subscribe to, highlighted in green. You can click on the programs to find out your assigned coach and also retake your BLA if you fail to do so initially. Thank you for watching this video.
Okay, thank you for watching the video. And so we are putting this question to you for all of our Achalugos on the call and even our Odugos. I know we have a lot of Odugos on the call now. Have you downloaded our Complete Health app? Please help me ask someone on the chat. And then have you started enjoying MDoc's self-care supports? If you haven't, please, the time is now. Thank you, everyone. Okay, so I'll hand over to my co-facilitator, Blessing, and then she's going to be running us through our oncology program and how we provide our service to our members living with cancer. Over to you, Blessing. Hi, Blessing. Are you able to unmute? I'm sure you should be able to do that now.
Hello, everyone.
Yes, we can hear you. Please go on.
All right. Can you hear me now?
Yes, we can. We can hear you loud and clear. Please go on.
All right. So welcome, everyone. My name is Blessing Raji. And so I just want to take you through our oncology service. So oncology service is designed to provide holistic support to individuals living with cancer or at risk of cancer, as well as to the relative or caregiver of the people living with cancer. So who are the members that we serve? Like my colleague said, we call them members, not patients. So we serve people who are living with cancer, who are diagnosed with cancer. We also serve those who are at risk or those who have a family history of cancer. So we serve such people as well. We serve the caregivers because we understand the burden of taking care of someone, right, who is sick. So we also take care of caregivers on the oncology service. Then for our superhero, our cancer survivors, right? So we also serve them. We ensure that we provide them with holistic support, the care they need throughout the journey. Please, am I still audible?
Yes, you are. Please go on.
All right, thank you. So now we just want to take you through what we do in MDoc, our oncology service. So what we do in MDoc is that we provide health education on positive lifestyle changes to improve the quality of life and the health outcome of the people we serve, our members. Also, we have this continuous health monitoring of our member status, their health status, through our complete health app. This is where both the coaches and the members interact and they cooperate their goals, their health goals, and also monitor the health outcomes on the complete health app. We also ensure that we provide health counseling for our members and also the loved ones, the caregivers, the relatives. We ensure that we support them with the adequate mental health care that they need for the journey. We ensure that we collaborate with our managing physicians, right, the physicians of our members, to ensure smooth communication, smooth treatment, to also report to them whenever our members have side effects of the drugs or they have complaints. So we also reach out to the members, the physicians, on their behalf. The next thing we do is to manage crisis management. This is to spot out things that can endanger the lives of our members, either the side effects or members that are going through chronic mental health condition. We ensure that we manage this and also refer them back to their physicians. On oncology program, we are focused on ensuring patient-centered care and the plan. We ensure that we include the patient in the treatment plan and also their caregivers. So we don't just go ahead to care for members. We know what is we ensure that we know what they need or what they want. So and nutrition counseling and fitness coach session. We all know that nutrition and fitness session is an important part of recovery throughout the journey of this cancer treatment. So we ensure that we provide them with adequate nutrition tips, right? Nutritional tips, and also encourage them to participate in exercises so that to improve their quality of life. Appointment reminders and medication adherence. The burden of cancer is much, right? So our coaches ensure that they place appointment reminders and also track the medication adherence, right, of these members. Please, next slide. So I just quickly want to take you through one of the testimonials of our member, right? We have one of our members who have decided to share his journey with us. So he was diagnosed prostate cancer 10 years ago, and he shared how the whole how it was challenging. Symptoms like he was not able to urinate. Then he quickly went to the hospital, and at the end of the investigation, he was diagnosed prostate cancer. It didn't just end there. The PSA at that time was 70 milligram not mg per liter. So the doctor also placed him on treatment and referred him to us at MDoc. So his achievement so far is that he was assigned a health coach who co-planned his health goals with him. And also after his surgery and his treatment, realized that his PSA didn't just drop down to 50, but he was realizing about 3.5, which is like a drastic change in his PSA. So he was also very thankful to his doctor, his urologist in his facility, and also thankful to the MDoc staff and Emmanuel, who is his health coach. And also thanks to all the organizers and those who are present on this call. Thank you.
Thank you very much, Blessing, for that. Please kindly note that at MDoc, we do not diagnose or prescribe. What we do is we support our members, like we call them, on the journey to recovery. So we just co-manage them on what their doctor is already treating them for, and then we follow them up with action plans that they can also imbibe and incorporate this lifestyle into their treatment. So quickly, before we go into our actual session for the day, we want to take another quick game just to ease the atmosphere in the room. So I'll be reading out some questions. This game is very easy. It's called Would You Rather. So we'll be reading out two options, and then I would like for us to be to interact with this game. So you pick an option and tell us the reason why you're picking that option. I hope you're ready. So would you rather be stuck? Please, I hope someone is helping me monitor the chat so we can take people's responses. So would you rather be stuck in Lagos traffic with no AC or no music? I hope the responses are coming in. And if anyone wants to unmute to speak, please, you can raise your hand. So I hope the responses are coming in. Please put your responses in the chat. Let's keep it interactive. The next one is, would you rather
I see
always have
majority of people are saying no music, no music. That
no
means
music but
everybody
AC? Of course,
AC.
that AC is very
Ghanaian does
important
not want
in
to be
Lagos
stuck in Lagos
traffic.
traffic at all. That's interesting. So majority AC is very key. Oh,
It's very, very
Nampak saying
important.
none of the above. So
Only
you
only
rather not
those
be
of us
stuck
in Lagos can actually relate. Some others may not relate, but those of us in Lagos will relate to the AC.
to the AC situation. I get it. It's super
All
hot.
right, so the next question, would you rather always have NEPA lights but no internet, or internet but no NEPA lights? Quickly. Let's do this quickly so we can get into real a motive for the day, basically. Dr. Kola, please help me with the responses. Are people responding?
Yeah, so people are saying, I mean, Daniel is saying that's a tough one. Ganiat is saying she would want NEPA lights without internet. Wow, so you have lights, but you won't be able to know what's happening around the world. Mubarak is saying NEPA lights, internet can wait. Mampak is saying lights. Isimehen is saying internet. Sound like me. I mean, um, Ima Obong is saying Nepalite. Tafere is saying internet. Jacob is saying Nepalite. Sheyi is saying internet. Solar will suffice. Interesting. People are thinking outside the box here.
Yes, so all right, next one quickly. Would you rather eat jollof every day for a year or never eat jollof again? Where are our jollof lovers?
Hi, Titi. Please, can this be the last one so that we can get to the speaker as well? Thank you.
All right, thank you very much. Okay, so do we have our responses?
Okay, people are saying so you don't get to say you eat jollof, you know, for long. But people are saying never eat. Collis is saying eating jollof for a year. Jacob is saying never jollof for a year. So it's mixed. I think the jollof and the non-jollof people are in the battle in the comment, but it's good to see. It's good to see. I think thank you
All right, thank
everyone.
you,
Thank you
everyone.
so
Yeah,
much
over
for
to you,
your
Dr. Kola.
responses. Yes. So we will be getting on our speaker now so that we can get to the meat of the matter, right? Not jollof of the matter, the meat of the matter. Today we have with us a professor, a subject matter expert who someone I've met one-on-one, and I understand his passion for his patients. Professor Stephen Odonye is a distinguished urologist and academic staff at the Lagos State University, specializing in epidemiology and treatment of prostate cancer. He is affiliated with the Lagos State University, where he contributes to both teaching and research in the field of urology. His academic pursuits focus on various aspects of urology, including prostate, kidney, and bladder cancers, as well as reconstructive urology. He has made significant contributions to the medical field, particularly in the treatment of prostate cancer. His expertise includes performing radical prostatectomies and utilizing advanced techniques like laser treatment for kidney stones, which he introduced at the Lagos State University Hospital, Lasut. This innovative approach has made kidney stone treatment much more accessible and affordable, you know, for patients in Lagos State and even outside of Lagos State. Professor Stephen Odunayekoro continues to be a leading figure in urology, committed to improving patient care and advancing medical education in Nigeria. Like I said, he is someone who I know has great passion for his patients, and it's our own singular pleasure and honor to have him be our expert for today. So please, with a round of applause, both virtually, both in the charts, both as emojis, let's welcome Professor Ekwero. Please keep clapping if you, so that, it won't he can engage with us. Please keep clapping as we bring him on board. Thank you so much, Prof, for being with us today. Please confirm, sir, that you are able to unmute and speak.
Well, good. It's the afternoon or evening, Sunday afternoon.
Yes, sir.
I'm sure you can hear me, please.
Yes, we can, sir. Yes, we can.
Well, thank you for welcoming me to the meeting today. I'm very happy with MDoc because a lot of my patients have given a lot of testimonies about the help you give. And even calling a patient with prostate cancer, those phone calls that you do to some of our patients and all that, they come back to tell me that, oh, thank you for introducing me to MDoc. So that's why when Stella mentioned this to me, I said, okay, it's a Sunday afternoon or whatever, but I will be part of it. So I work at the Lagos State University College of Medicine in Ikeja and at the teaching hospital in Ikeja as well. This month is the prostate cancer awareness month. So I guess that's why also MDoc is introducing this topic this month. So we just talk briefly about what prostate cancer is all about. Okay. Well, as a beginner, I'll just mention that I'm a urologist, and what we do is to deal with those problems with the kidney, the ureter, the bladder, and the prostate, and then the genital organ. The prostate is only present in men, so women don't have prostate gland. Yeah. So what's actually the prostate gland? It's actually an accessory reproductive organ in men, and it's found just below the neck of the bladder. I don't know if you can see my arrow. So it's just below the neck of the bladder. What does the prostate? What does it really do? Why is it there? Okay. Its main function is to secrete the fluid that helps to nourish and liquefy semen, so it will be easier for spermatozoa to move faster and perform their job. That's all the prostate gland does: production of that fluid that nourishes and liquefies semen. It's not a very big gland, just the size of a walnut, but it grows bigger as you get older. So as I mentioned, just below the neck of the bladder and in front of the rectum, this is the rectum where poo comes from. So you have the prostate gland there. So what are the problems the diseases that the prostate may have? Well, I will just say three basic important diseases. The first one is what we call benign prostatic hyperplasia, which in other words just means simple enlargement of the prostate, okay? And the one we are concerned with today is prostate cancer, okay? And that is the one that is cancer, that is the malignant, the most dangerous one. Of course, the third one is prostate infection that we call prostatitis. So I'll just dwell on prostate cancer today because of that is where we are, what we are doing today. So if you look at that, is the normal urinary bladder of a young person, okay? And you will see that yellow part that is below the neck of the bladder is actually the prostate gland, okay? And if you look at the passageway there, it's very free and open. So it's easier for this person, to empty the bladder when the bladder is full. But the thing is that as you get older, this prostate gets bigger, getting bigger either from simple enlargement or from cancer. And then this is what happens. When it gets bigger, it obstructs and narrows this channel through which urine comes out from the bladder. And the bladder muscle becomes thick because it's working against resistance. And most of this will give rise to most of the symptoms that you have from bladder out there obstruction from prostate enlargement. So prostate cancer is actually the most diagnosed cancer and the leading cause of cancer deaths in Nigerian men. And what happened in prostate cancer is that the cells of the prostate begins to grow, abnormally. They divide abnormally and grow bigger, and grow into multiple cells. And some of these cells have the potential to also invade, to destroy cells that are around, destroy tissue that are around, and they can spread to other parts of the body, from the prostate spreading to virtually everywhere in the body. So when you have a disease happening in the prostate like that, originating from the prostate like that, you say that is prostate cancer. So in other words, in a simplified form, this is what I'm trying to describe. So we have what we call early prostate cancer, okay? So that's the first thing I'm talking about now. So if you look at it and you see this round stuff that I just drawn here now, assuming that is a prostate with its capsule. This is a capsule, the covering of that prostate is the red part, okay? And this blue part is the prostate, okay? So what happened is that this little blue stuff begins to appear in the prostate. That's the prostate cancer. So if you catch a prostate cancer patient at this stage where it is just within the prostate, then we say this is an early prostate cancer. It's localized. It has not spread at all. And this is potentially curable, okay? But if you leave it not doing anything, can you see that the tumor has grown bigger, and even bursting out through the capsule, through the covering of the prostate, is now bursting out. So that's a bigger prostate. So it's becoming what we call locally advanced, getting bigger. And if you still haven't done anything about it at this stage, then it spreads to different parts of the body. It spreads to lymph nodes, it spreads to other organs, and it spreads to the bones of the body. And that is the way prostate cancer usually, that is why it grows in the body generally. So it could be in the early form, or when it has gone beyond the prostate, becomes an advanced or late disease. So how common is prostate cancer? It's actually the most common cancer in men in Nigeria. And the most distressing thing is that in our environment, more than 70% of our cases are discovered when it's already advanced and at this stage potentially incurable. Okay. In Lagos, based on the Lagos State sponsored prostate cancer screening that we did in Lagos a few years ago, we found that 12 out of every 1,000 men who were age above 50 that we screened actually had prostate cancer. And they are living in Lagos, on the streets of Lagos. Majority of them don't even know they have problem with their prostate. So in one's lifetime, a man has 50% of men will eventually be diagnosed with prostate cancer in their lifetime, eventually. So it's a very common problem. So who is at risk of developing prostate cancer? And my answer there is every man. Okay, so that prostate cancer, little thing that you see there, can grow in a prostate of every man. So what are these risk factors? And the first thing I mentioned that it is every man. Okay, it's every man that is at risk of prostate cancer. And it is not a contagious disease. You can't pass it from one person to another. The most important factor, apart from being a man, is the fact that you are getting old. So if you have problem with the prostate, it shows that you are getting old. In fact, my teacher in the university used to tell me that prostate diseases are blessings of old age. So that shows that you're getting old when you begin to have problems of the prostate. It is rare before the age of 50, okay? So there are a few patients that we've seen who are less than 50, but generally it is rare before the age of 50. And occurs at about the age of 60. Most of the patients are around the age of 60, which is the age of retirement. So the prostate cancer often comes to retire you at retirement, and that's why before you get your retirement, you are beginning to check what your prostate looks like. And it is more common in blacks. In fact, it's twice more common in blacks than in white men. So the fact that you are a black man, also you have a higher risk of having prostate cancer. Then family history. If you have a family history of prostate cancer, whether your father had prostate cancer, your brother had prostate cancer, your cousin, your uncle, things like that, then your risk of having prostate cancer will increase by 2 to 3 fold. So if you have a family history, it's very important you check very quickly. Then there are a lot of genetic factors that we are now discovering, okay, that also make people to develop prostate cancer. What about sexual intercourse? This is actually not conclusive. There is no conclusive result on the relationship of sexual intercourse with prostate cancer. Of course, there is a popular study that talks about, the more ejaculation you have, ejaculate 20 times in a month or 21 times a month or so, and to prevent prostate cancer. This is not conclusive, and it's only a single study. And those studies were actually for those who had those ejaculation in their 20s. So, the relationship between sexual intercourse and prostate cancer is not conclusive. But I mean, since one study mentioned it, so it may be protective. So if anything at all, enjoy sex. Diet, it's another thing. Diet that is high in saturated animal fat can double your risk of developing prostate cancer. But when you have a diet that is rich in vegetable and fruits, this may be protective. So how do I know that I have prostate cancer? How do I know that? What are the symptoms? Prostate cancer generally will present with no symptom, okay, until it is becoming advanced. It becomes advanced stage. So you can only discover it on routine screening. On just check annually. You go to the doctor. You go to and check. If you don't do that, you will never discover prostate cancer early. When it begins to bring symptoms, then it's already getting advanced. And what are the problems it may bring? Problems with urination. Consider man trying to strain to push urine out, and the urine is just falling almost between his legs. The flow is poor, and he has to wake up many times at night to urinate. Those are problems that may come with urination problem. It may also come with problems with erection, losing your erection. That could come that way. It could also come by having blood in the urine. If you see blood in the urine, it's a danger signal that you need to see the doctor quickly. Of course, sometimes it comes by the time the cancer has spread. You begin to have symptoms of pain in the bone or paralysis, pain in your back and then paralysis. You can't walk, you can't carry the legs well, cough, or losing weight. Those are different ways that prostate cancer may show up. So what do we mean by screening? How do you screen? The screening for prostate cancer should begin for us in this part of the world from age of 45. But if you have a family history, you should start to check yourself from around the age of 40. And what are the screening methods? The first one is a blood test, a simple blood test. In its own, it is not diagnostic. It is called prostate-specific antigen. In other words, called PSA. We just take this blood sample, we take it to the lab, and we check the level of your PSA. If the PSA is high, then we may suspect that the person may have prostate cancer. But of course, there are other things that may make the PSA go up, including infection, including prostate enlargement. That's why it is not diagnostic. So we have to do other things to confirm whether this rise in PSA is due to cancer. So you don't need to panic if your PSA goes up. You don't need to panic. You need to evaluate why the PSA has gone up. The other one is called digital rectal examination, where the doctor puts a finger in the anus of the patient and goes into the rectum to feel palpate the prostate and feel what is the nature of the prostate. What does the prostate feels like? So those are the two ways to basically detect it early. So you can do those PSA and digital rectal examination. You can include it as part of your annual medical evaluation. Lab tests and imaging may then be done once we suspect this disease. What are these lab tests supposed to do to help us to make a diagnosis or to confirm the diagnosis, determine the stage of the disease? Is it early or is it late disease? And determine the grade. The grade means how aggressive the cancer is, because this thing we call prostate cancer behaves differently from one person to the other. The biological behavior could be very different from one person to the other. So don't think because that's your neighbor had prostate cancer and is dying or nothing is happening, don't think that because of that, your own will follow that way. They behave differently from one person to the other. And some of these lab tests can also help you to prognosticate and then to follow up the patient and follow up with the treatment as well. How do we treat prostate cancer? I'm not using big word. I don't want to bore you with big terminology. So I've told you that it could be an early disease or a late disease or advanced disease. So if it's an early disease, we actually have a goal when you have an early prostate cancer. The goal is to achieve a cure for the patient. That's the goal. But when you have an advanced disease, the goal is no longer a cure, but palliation, because at advanced disease, you may never, at least for now, based on the treatment modalities that medical science can provide now, you may not be able to cure, but you can manage the disease for a long time, you know. So for early disease, you have surgery, you could have radiotherapy, cryotherapy. These are different forms of treatment that can be offered. But for advanced disease, we talk about hormone therapy, chemotherapy, and medications to manage pain. And a lot of new treatments are coming up now to treat prostate cancer. And it is hoped that in future, maybe we'll even find a cure or a solution even to advanced prostate cancer. So how do you cope with prostate cancer diagnosis? So when you have a prostate cancer diagnosis, just know that it is not a death sentence. There are patients who have prostate cancer. I have a patient who had prostate cancer since 20 years now, and he's had hormonal treatment for the past 20 years, and he's still alive and well, you know. But there are people who will die, soon after the diagnosis. So it depends on the biology and the aggressiveness and the response to treatment. So it's not a death sentence, you know. It's a time to keep calm and then make up your and follow the instruction and discuss with your doctor. So many patients will die with their prostate cancer. You know, even those that have diagnosis, they will die with the prostate cancer rather than from their prostate cancer. So a lot of patients will survive for a long time. So you should discuss the treatment option with your doctor, including complications and side effects. You know, there are a lot of side effects even to even the treatment, whether it is surgery or hormone therapy or radiotherapy and all that. And some of these side effects may include problems with sexual sex, you know, problems with erection, problems with ejaculations, and even problem with fertility. So you can have a lot of sexual problems with prostate cancer and its treatment. And sometimes it can also cause incontinence of urine. Either the prostate cancer itself or even the treatment that you may give can lead to incontinence of urine. So many times this incontinence doesn't last long, maybe for a temporary period of time shortly after treatment, and a lot of it have solutions, you know, to resolve. The drugs too may have side effects, okay? Side effects for hormonal treatment, including hot flushes, for example, you know. So these are some of the things you need to discuss with your doctor. And don't forget, even when you catch prostate cancer early, about 30% of them will still come back, we still recall, you know, after some time. So the monitoring, the follow-up is a lifetime follow-up for such patient who has had a diagnosis of prostate cancer. So the recurrence of the disease is also a possibility. So you should bear that in mind. And you may need further treatment in future. You may need further follow-up care. And then you have to think about the finances. You know, prostate cancer treatment often involves a lot of money, a lot of funding for the treatment. And you should not forget to discuss about how you can be supported psychologically and socially as well, including your family and your business and whatever else. And don't forget about nutrition. Don't forget about exercise. These are all important in managing prostate cancer, in helping you to build up your immunity to be able to fight the cancer itself. And also, sometimes you get to the end of life where the prostate cancer has become so advanced now, and this person is likely to die from prostate cancer. Then that is the time that one needs to discuss the end of life care for with such patient and the family, and to prepare for the eventuality, which includes what are your plans for your loved one, the plan for your businesses, and all that when you are no longer there. So we shouldn't forget about that as well. So I summarize or end this way, that prostate cancer may hit you below the belt, but you can use the belt to strangulate it by seeking appropriate treatment and also still enjoy life even after the diagnosis. So I'll end here. Thank you very much.
Thank you so much, Prof. Thank you. Please, let's put our hands together for Prof. I think this has been a wonderful, wonderful session. A lot of information in, I think it was condensed into a very, very, short time frame. But thank you so much. I think you went through a lot, Prof. We really, really appreciate you for taking our time to walk us through this. Please, let's keep the applause coming. I think Prof deserves, the applause. Thank you so much, sir. So we have a couple of questions, while you were having the session on. We have some in the chat and we had some from our YouTube, because we had people also watching on YouTube page. So I'll just go through the questions very quickly so that you can, help us provide responses to them. So the first one, in the chat that we have here, sorry, just trying to bring it up. Just 1 second. Yes. Okay, so we have the first one in the chat, from one of our participants, that what is the reason for the high rates in Black people? I don't know if you have a response to guide us around that. The person asking me is, what is the reason for the higher rates in Blacks than in other Caucasian populations?
Well, that most likely is due to our genetic makeup, which is different from that of Caucasian or the Asians. So our genetic makeup, especially. So our prostate is different. We are different from them. That's just it.
I'm trying to. Sorry. Yeah. So thank you so much. The other question that also is up here is there a connection between prostate cancer, I believe, and lumbar spondylosis? I think the person wants to know that. Go ahead. You can go ahead, sir.
Yeah. So the relationship between the two of them is they occur in people that are getting old. Okay. Lumbar spondylosis shows that your spine, your spinal cord, the bones there is getting old. So it's degenerating. Okay. So and prostate cancer also occur as you get old. That's number one. Number two, we should not forget that one of the most common sites that prostate cancer will spread to when it starts spreading is the bone of your back. And it may start with that back pain, and it will look like lumbar spondylosis. So it is important for us to do some tests to differentiate. Are you dealing with lumbar spondylosis, or are you dealing with prostate cancer with a spread to the spine? That's very important. Thank you.
Thank you so much, sir. Thank you so much for that answer. So we still have a couple more in the chat. So what we'll do is, Prof, maybe we can help look at the chat if you can respond to any of them, because we don't want to keep everyone beyond the time that we allotted. But thank you so much, sir, for this. And then we'll be moving to the post quiz. I believe we have learned a lot today. So we want to see how much we have learned, as participants on the call. Again, just to respect everyone's time, because we have just a couple of minutes left for the session. This has been wonderful. Thank you so much. So for us on the call, there is a post quiz that is coming up shortly. And Prof, for the ones that you can help us respond to in the chat, please, that will be wonderful. Thank you so much, sir. You've been really, really helpful today. We really appreciate your presence with us today. So please, let's all respond to the post quiz survey. Now we have learned, I believe we know what prostate cancer is, how it starts, how it grows, the risk factors, etc. that can happen. So let's see how that knowledge is being translated. Let's answer the post-quiz questions. So it's up on your screen. You should see it on your screen right now. If you haven't challenged, please let us know. But please, you see it on your screen. And if you can, just go to the 3 dots part of on your screen and click on on the quiz as well. Yeah, so please let's start answering the quiz, post-quiz questions, up now on your screen. And just wanted to double back on something that Prof said. Prof said while he was presenting that nutrition is important, exercise is important. So if you know someone who has been diagnosed with prostate cancer, or you know someone who is living with prostate cancer, you would refer to what my colleague also said while we're presenting, that at MDoc Healthcare, we understand that these things are very key. And as such, we've designed our oncology service program to actually focus on these key things that would help support the members through their journey, and also involving their loved ones, the caregivers, right, in the healthcare system, where we also connect them to their provider. So like we said before, we don't prescribe, we do not diagnose. Our own goal as an organization is to build the ecosystem of care for those who are going through this journey, or those who are at risk of going through this journey, so that they can receive support that they need to live healthier and happier lives. So please, if you want to know how to, know anyone living with a disease condition or anyone at risk, we are happy to provide the support needed. So we have the post quiz up, like I said, and we're giving a couple of minutes just so we respect, the time that we've allotted for this session. So please, let's start answering. Quickly. We have a couple of minutes. We're gonna give like 2.5 more minutes so people can answer. Mampa, can you confirm you can see the post quiz now? If not, Rodri, could you please help attend to Mampak so the post quiz can be available? Okay. So someone is going to attend to you now to get that, to provide a guide on how to get it so you can see. I think it should be, there's a way you can get it as well from your screen. But please, let's keep the post quiz responses coming in. Let's keep it coming in. Thank you. I see the rest. We see the responses. Thank you so much. Thank you, everyone. Thank you for engaging. Thank you, Prof, for your time and walking us through, this. This is why we do this, so that everyone can learn and understand and be able to do better. So to people who are not able to see the post quiz, please, team, let's help attend to them. Someone is providing a guide to you in the chat on how to do it. So you can click on the 3 dots. There's a 3 dots towards the right of your screen. Click on it, and then you can click on launch the quiz, and then you would be able to see it, I believe. So can you please try that? I think that should fix that piece. We have 2 minutes left to answer the post quiz surveys. Thank you so much, everyone, so far for participating and contributing and engaging. This has been a wonderful session so far, and we appreciate you all for your time. Thank you so much. Okay, I see more responses are coming in. Thank you, everyone, for providing the responses. They are now rushing in. Thank you so much. We can see the improvement in knowledge, right off the bat. Thank you so much to everyone. We'll be wrapping up the post quiz in the next 1-2 minutes. Please confirm that you can see. Okay, another person can't see the quiz, Chinedu Mokong. So please click on the 3 dots on your screen towards your right and click on launch quiz. I believe you should be. So Mampak, have you tried clicking on the 3 dots and clicking on the launch quiz? The quiz is still on, so you should be able to see if you do that. Please try doing that. I think it should come up. Okay, and it's still not coming up for you. Rodri, could you help with that, please? It didn't come up when you tried doing it. Okay, still not coming up. Okay, so the post quiz is still on. The post quiz is still on right now. I think the team is trying to get across to you to provide the responses. Yes, so select polls and quizzes, then it will come up. So yes, the one that shows more, the 3 dots that shows more. and then you see polls and quizzes. Then you select polls and quizzes that need to come up. Please, let's try that and see. I think that should bring it up. That should bring it up. Thank you. We're gonna give 2 more minutes because of that glitch, so that we can all be a part of the post quiz. I see we all want to do this, so please, we'll give 2 more minutes. So I see Chinedu, Mampak. Please confirm that you are able to now see the post quizzes from your end. Okay. All right. Thank you, Prof, for answering people's questions in the chat as well. Thank you so much. So if you have asked a question in the chat, oh, okay. Thank you, Malam Galba, for confirming that you can see it. If you have asked a question in the chat, Prof is attending to you. Thank you so much, Prof. We really, really appreciate this. Thank you. Okay, all right. Now I see more people are bringing in the response. So we're closing up the post quiz in the next 1 minute. Thank you. So please quickly do the post quiz so we wrap that up. Thank you so much. It's been a wonderful session so far. I believe, I'll do a countdown shortly in the next 10 seconds so that we can, move on to the next piece. Okay, thank you so much. I see the responses coming in. Okay, all right. So wrapping up in the next. Yeah, so Chinedu, I see your question. Prof is, attending to the question. We will also be in the lookout for the ones that are yet unanswered, and we would, surface that up. But thank you for bringing that up as well in the chat. So again, if you've asked a question, look at your comments in the chat, and I'm sure you'd see, Prof's response underneath the questions that you have asked in the chat. Thank you so much, everyone. We're closing up the poll in the next 10 seconds, and I'll be counting down, 10, 9, 8, 7, 6, 5, 4, 3, 2, and 1. Thank you so much. I believe we can end the poll so that we can get the right responses from Prof before we wrap up the call. Thank you so much. So we will be going through the questions with Prof so that he can help us with the right responses now. So very quickly, who is going to pull that up? Roderick Titi, can we pull that up so that we can go through the question with Prof? Thank you. Okay, so Prof, the first question we asked, again, we try to make it as simple like you also helped us did. What is cancer? And the responses that we had, was either abnormal healing of damaged tissue, B is abnormal cell growth, C severe infection, and D unexpected weight loss. Majority of people went for B. We want to confirm, Prof, is that the right answer, sir? Oh, sorry. Yes, I think you're muted now.
Yes, it's okay now. Yeah, that's
yes,
right.
Prof.
Yeah.
Thank you so much. So majority of us got the responses right. Thank you, Prof. And then the next question we asked is cancer contagious? Right. So the first response is, yes, it's highly contagious. The second one is contagious from blood. The first one is from sneezing and coughing. The third one is no, it can't be spread between people. And then the fourth one is no, it's spread through food and water. Majority went for no, it can be spread through people. Prof, want to confirm, is that the correct answer, sir?
That's correct.
Absolutely. So people have really learned today. Thank you so much. The next question is, can cancer spread from one part of the body to another? The first response is, yes, through blood or lymph nodes. Second one is no, it stays in one organ. Third one is yes, but only in the elderly. Fourth one is only in children. Majority went for yes, but through blood or lymph nodes. Want to confirm if that is the right response, Prof?
Yes, that's correct.
Oh, so people have really learned. Thank you so much, sir. And then the next one is prostate cancer affects most men in which of the following groups? We have under 30 years as the first response, 40 to 49, 50 to 70 as the third one, and then same risk at every other last one. Majority, 81% went for 50 to 70 years. Prof, is that the correct answer, sir?
That's correct.
Thank you so much, sir. All right, so the fifth one is saying, how does prostate cancer or its treatment affect a man's sexual health? We have difficulty in engaging sexual activity, causes infertility, has no effect, increases sexual desire. Majority went for A, but we want to hear from you, Prof. From this
Yeah,
one, what is the right response there?
that's correct.
Okay, thank you so much, sir. All right, so the number 6 says, which of the following may be an early warning sign of prostate cancer? There is difficulty urinating, persistent cough, rash, sudden loss of vision. Majority went for difficulty urinating. Is that the correct answer, sir?
Excellent.
Thank you so much, sir. And then the 7th one is about which test suggests early prostate cancer is recommended for early prostate cancer screening. A is blood pressure, B is abdominal X-ray, C is PSA, and D is ECG. Majority went for PSA, sir.
That's correct.
Thank you, sir. And then the last one is prostate cancer curable? A is saying no, it's not treatable or curable. B is yes with surgery, medicine, or a combination of these treatments. C is with traditional herbs and dietary changes. D is yes if it spreads to other organs. Prof, we want to know which one is the most correct answer here, sir.
Right, B. Yes, correct. B.
All right, thank you so much. So it shows that all of us we've learned today. Thank you so much, Prof, for having the session with us. We can all see that we've learned from this session, and it's wonderful having everyone with us throughout this time. We want to now, put. If you're on the call, you can feel free to follow us on our social media platforms, Facebook, Twitter, Instagram, LinkedIn, and also on YouTube, where this session is also going to be put in case you want to reference after today. And then, of course, after now, you can also sign up on Complete Health. The links we put in the chat for everyone to sign up on our Complete Health platform to join our Navi Health, where you can see referrals and be referred to facilities of care that you need. And then, of course, we would also be putting that in the link for you all. The YouTube link is already in the chat. You can subscribe to our YouTube so that you can reference this after the call. And I think for us, I believe we have come to the end of the session today. First of all, I want to appreciate Prof for making time on a Sunday to come around. Like I said, I met Prof one-on-one when I went to meet him in last week, and I know his passion for the patients, his passion to ensure that they have what they need to actually live healthier lives, and his passion working with us at MDoc Healthcare as well. We appreciate the relationship, and for us, we would hope to, hope that more of the engagement will continue. Thank you so much for making our time, and thank you everyone for coming. Please do enjoy the rest of your day. Thank you so much. Okay, so while we, okay, no problem. Thank you so much, everyone.